Okay, so let's talk about the BBL death rate. There is so much arguing in the comments, like I can't even get it straight. So I just picked your comment randomly because I keep seeing this number given and I want to explain where it comes from and why we think BBLs are the most dangerous cosmetic surgery. So first, let's talk about how people die after cosmetic procedures. And remember, this sounds scary, but it's very, very, very rare in both of these circumstances. So we'll talk tummy tuck versus BBL because tummy tuck keeps getting brought up. So when someone dies after a tummy tuck, it's not from something that was done in the OR wrong, incorrectly, etc. It usually happens from a blood clot that breaks off and goes to the lung. So after surgery, you're at higher risk for blood clots. If you get a blood clot after a tummy tuck and it goes to your lungs, that's typically why people pass away suddenly after a tummy tuck. And that doesn't happen right in the operating room. That usually happens a week to 10 days after surgery. It can certainly be closer, but that's the normal chain of events. And again, this is a rare thing. Now with a BBL, people die from what's called a fat embolus. So it's a direct effect of what you're doing in the operating room. And why surgeons are uncomfortable is because this is a blindly done surgery. You are doing it without direct visualization of where you're injecting the fat. And so when people get a pulmonary embolus from fat, a fat embolus, it's because it was injected in the wrong place. So I think as a surgeon, this feels very different. So both of them are horrible, but having someone die because my hand did something versus a complication from just being a surgical patient feels very different, which is why a lot of surgeons shy away from this particular procedure. Now, I also want to add that as we learn more in surgery, our death rates get better, right? Because we are learning from what's happening and improving our outcomes. So for tummy tucks, for example, it's very common for people to be anticoagulated afterwards if they meet certain criteria so that they don't get a blood clot and they don't suffer that horrific complication. BBLs are the same. We have learned you don't inject in the butt, you don't inject in certain ways, and death rates have dropped as well. So looking at BBLs in particular with the death rate, you're going to look at older studies which show anywhere from 1 in 2,000 to 1 in 3,000 to the newer studies that are 1 in 15,000, which is the one that you keep posting the PubMed link to. So when you look at this 1 in 15,000 number, this is coming from a survey of board-certified plastic surgeons. So this is the outcomes from the elite people in the field, from those of us that are the best trained, that do the most of this. So this is going to be the best possible outcomes, and that's not who are doing a lot of the BBLs out there, to be frank. There's a lot of cosmetic surgeons and people who aren't properly qualified. And there's also people that are getting cheap surgery done out of the country, and it's just impossible to get a handle on those numbers. What we know in the community is we see people in the ER all the time from not properly trained people with horrible outcomes, and there's just no central reporting. So this new Florida law is trying to address some of this by requiring hospitals to report BBL admissions and ER visits. So we can live in a world where multiple things are true at once. And so although the death rate has dropped significantly for BBL, it is still a significant death rate for a cosmetic procedure, something that is not medically needed. And I think it's reasonable for people to point that out. And then also using old tummy tuck numbers versus new BBL numbers is also disingenuous. I think tummy tucks is an extremely safe procedure, and we know how to prevent a lot of these horrible complications. It's also important to note that a lot of tummy tuck patients are functional tummy tuck patients. Even if they're listed as cosmetic, their insurance may not have covered it, and they're potentially a higher risk patient population versus the BBL population, which should all be cosmetic. And then I also want to point out that it's not a 3% death rate. So 1 in 15,000 is 0.007%, not 3%. Sorry, I just had to point that out because 3% would be really high. There would be literally no surgeon in the country who would do an elective cosmetic procedure on someone if there was a 3% death rate. That's just unethical and wackadoodle-doo. Okay, and the last thing I'll mention is that they studied deaths in South Florida. They looked at a time period and all deaths from BBL were examined. The death rates there are higher than anywhere else in the country. And they found a commonality. All of them came from high volume, low cost clinics. So places where the surgical time was like 90 minutes or less, they did 10 of them a day, high volume injections. This is not where you want to go. You want to go to someone who is very experienced, board certified plastic surgeon, and who takes time to do your procedure properly.